shoulder issues or know someone with shoulder issues. And if you have a shoulder issue, don't raise that shoulder up. Okay, so a lot of people, right? Shoulders aren't as complicated as they seem. To break that up a little bit, let's take a quick look at a video here. So I'll kind of dictate you guys through this. So, if you look at the anatomy of the shoulder, really what we're looking at here are kind of spaces on the actual shoulder blade. So you have your shoulder blade here, and you have some spaces, little nooks and crannies, and those are all inhabited by the muscles of the shoulder, the rotator cuff muscles. So here we'll show you a few to kind of see where they're at. So here's the shoulder. So these are the larger muscles. These are the ones that cover up the rotator cuff, and they're the big movers. So they're the ones that actually give you most of the movement. The rotator cuff muscles are the ones that give you the finite movement, and they're very important because those tiny movements could play a huge deal in pain and other symptoms that you may have. So if we cross-section it, we take off the big ones, you start to see kind of the smaller ones here, which all kind of attach at different points to your humerus, which is your arm. So here you rotate a little bit and you see one of the rotator cuff here, and there's a little one coming in here too. So there are 4 rotator cuff muscles. We're going to talk about those. There's a supraspinatus, infraspinatus, which is below that. We have the teres minor, which is coming through a little bit here. And then we have subscap, which is on the other side. So it's on the front of the shoulder blade. So those are the 4 rotator cuff muscles. So here's a quick visual on some of the other muscles we have for the shoulder. We have the trapezius, which is the main neck muscle that we always talk about when you scrunch up when you're sitting. Most people think that it's only the top portion, but it actually spans pretty far down. So down your thoracic spine. So it has a large attachment. We'll talk about the differences because there's 3 parts of the trapezius. The one that's commonly affected is the upper trap, which is the one we overuse. But the other 2 kind of just hang around. They don't get used very often. And then we have the lats, which are giant muscles that swimmers, when you see swimmers swimming, they have the giant like bat wing shaped muscles. That's the lats. And then we have the rhomboids here that attach and kind of control the shoulder blade, and the levator, which helps rotate the neck, and that's commonly stiff as well on a lot of our patients. So that's just a quick little anatomy. I put the slide in to talk about nerves. Although we're talking a lot about muscles and pathologies, nerves are really important. Just because they're in such close proximity to the shoulder and also all the muscles around there. So as you can see, right, we've kind of adapted this posture here, right, over time. So our bodies are not meant to be in this position for very long, in that sitting computer desk, right, scrunched over, typing most of the time. We're meant to be moving around, using our muscles, grabbing things, climbing things, running away from things, not sitting at one place for a long time. So what happens with that is you have tightness that builds up, especially in the front, right? Because if you round something, the front of that gets really tight and compressed. And one of the big ones that gets tight is actually the pectoralis minor, which is this small muscle underneath the main pec muscle. So it's a smaller cousin of the big pec. And you have all these nerves that come through the neck, right? So all through here, and they come down into the arm. And they all pass underneath that small muscle. So imagine if that muscle is shortened, there's a tendency to kind of compress those nerves and send signals and pain down the arm. So that's where you get the carpal tunnel issues that most people think it's just in the wrist. A lot of times it's coming from the neck and shoulder. So we address the upper part of it to relieve symptoms in the lower part. So this is a very important kind of concept to think about. So it's not only muscle, it's a lot of nerves that come through there as well. Now, let's look at kind of what the shoulder looks like. I think about it as a golf ball on a tee. So imagine the size difference, right? The tee is very small and the ball is pretty big. Now, the reason behind that is that we get mobility out of it. The shoulder is a mobile joint. So we get a lot of mobility, but we lose stability, right? Because it's such a small little area with such a big ball that kind of rotates on it. So inherently, the shoulder is unstable. But how we make it stable is we have these muscles that attach around the shoulder, and it moves it around and it keeps it where you want it to be. But it also gives it a lot of opportunity to move in a bad position. So that's where we're trying to fix that, right? That postural, working through posture, strengthening these muscles. So again, the rotator cuff is one of the muscle groups that help us keep that stability. But also the shoulder blade itself, or the scapula, is an integral part of why the shoulder needs to be in a good alignment. So think about it this way. It's you have the railroad, right? And you have the train on the tracks. So you have the two pieces that need to work together to get you somewhere. And that's the same thing with the rotator cuff and the muscles of the shoulder blade. So they're working hand in hand consistently as you reach for stuff, reach around, so that's all important. And then you have the thoracic spine, which is another integral part, and that's the kind of upper back, mid-back, upper back, because without that being in a good position, you can't reach as high. So imagine if you're slouched and your upper back is curved down, then you won't be able to reach as high as if you were standing straight. So those are the three big components of why it's important to look at the shoulder. And obviously you want to prevent future injuries. So not only do you want to rehab, but you want to prehab. So before you get to PT, before we see you, it's good to work on these issues before they even creep up. Because they're usually not a one-time deal. They usually start slow and they build up over time. So if you can address it before you have pain, it's even better. So now let's talk about posture, right? Posture is one of the biggest things we always talk about. We preach it nonstop. What we see commonly, and this is a little exaggerated, but as you can see, when your head is pushed forward, right? So your head is pushed forward, and that's because we sit, angled down. What happens is that a lot of muscles get tight.
Sorry, I can't search the web on Apple Watch.
That's Siri. I turned her on. Okay, so muscles that get tight, primarily the ones that we talked about, right? The upper traps, the ones on the top of your shoulders. They get tight, and then your pecs get tight. So there's this cross pattern that we see commonly, and they talk about this in journals all the time. They call it the upper cross syndrome. So upper meaning top of the body, cross meaning there's an X through these muscles. So we have the tight pecs, we have the tight traps, and then we have weakness in the front of the neck because our necks are so far forward. And we have weakness in the rhomboids and the lower trapezius. And remember before we talked about how the traps have that triangle shape that come down? The bottom piece of that muscle is not getting work at all. It's kind of getting lengthened and it's getting weaker because the top portion is getting so much work. So it's constantly getting pulled up. So it's kind of yelling at you to strengthen it because otherwise your shoulders are going to start rounding more, your neck's going to go forward, and you're going to have other pains that may be related in the neck as well. And there's a cool picture here from the Essential Anatomy app that shows you this little triangle here of tiny muscles in the top of your neck. There's little nerves that come through there. If you ever had tension headaches where you have like a one-sided headache that comes on, a lot of that times is because of the posture and where your muscles are and how tight they are. So it's really important not only to address the muscles, but to address the overlying cause, which is the posture. So Michael's going to talk a little bit about upper cross syndrome.
Yeah, so I'm going to expand a little bit on what Alex said. So there is a doctor out there named, he passed away a long time ago, but his name was Vladimir Janda, and his Janda approach, his premise was that it's a sensory motor system. So both your muscles and also the nerves work independent from each other. So you have to make sure that both, what Alex said earlier, making sure that the posture for your muscles, making sure that they're aligned. And if there's a muscle imbalance, kind of like what we saw in the slide ahead, if there's a muscle imbalance of weak muscles caused right here, and then a tight muscle that occurs right there, it causes that imbalance to occur, which right now, that's one reason why I have these pictures. I have a feeling maybe half of you probably fixed your posture after you saw this photo right here. So, so also it's the central nervous system. So those are the nerves that run along the neck, that run along the shoulder. That's also very important for motor programming too, because then if these two are not working together, kind of like the track, if they're not working together, that's what creates that bad posture. And he described it in two different phases. So there's the tonic muscles and there's the phasic. The tonic are the flexors, so it's the front muscles, the pecs, the neck flexors, so that happens, it tends to tighten. And then for the back part, or the extensors, those are your eccentrics. So that's the eccentric, just remember, works against gravity. So if these become weak, then gravity's just constantly going to push on you. So with these lines right here, this is, just pretend that's the gravity. So good posture, you're going to have straight head, straight shoulders, right? And then, but if we're in front of the computer desk or texting while driving, then that's going to be a forward head and that's how cops catch you in the first place. So just remember, I like to think of it like the needle, okay? I like to think of a needle, but try to think of it like you want to be in the good zone. The optimal point is when you're at the tallest, okay? And you add 2 inches to your height too, so that's the other benefit for having great posture. It's not only preventing further injuries, but it's also, you look confident, and also you prevent more injuries.
So this is a picture that was used in our book when I was in PT school, and I love this picture the most. It's from a kinesiology book. It kind of shows you with the arrows how these rotator cuff muscles work to get the shoulder moving. So what happens when you lift your arm up or to the side is that there needs to be a roll, because it's a ball, right? So it needs to roll up as it slides down to clear the space here, right? Because if it keeps rolling, it gets hit right underneath that bone here. So it needs to slide down as well. So there's 2 components to it. So if you have muscles like the deltoids, which are big muscle groups on the side, if they start pulling your shoulders up, something needs to trigger the pull down as well. And that's where these subscap, infraspinatus, teres minor, those little tiny rotator cuff muscles, they're small, but they're also very powerful because they have a good line of pull. So they pull it down and it slides it down. So you clear it, right? And this muscle here, which is kind of stuck in the zone, is yelling for this to slide down, because if it doesn't, it's going to get hit, right? This muscle is right in that zone, right in that space. And that's where impingement comes. When you hear impingement, that's this muscle getting hit over and over every time you lift your arm up. And how many times do we do that, right? All the time. Even when you're driving, this whole position here, that's your arm lifted for a prolonged period of time. So, right, this kind of outlines it. So the supraspinatus is a spacer. It's hanging out here, filling up that space. And it's a very small space. It initiates the movement. So it starts this movement of the shoulder coming up, and then the deltoid picks it up after that and finishes it. So it has that initial movement. Then you have the infraspinatus, which does external rotation. So it does this movement, right? So it pulls the arm out. And why that's important is because when you lift your hand, there's a bone in front, kind of in this area here. It's called the greater tubercle. It's a little tiny bone projection. If that doesn't get twisted outwards, it's going to get stuck because it needs to go up and slightly out. That's why if you lift your hand downwards like this with the thumb up, and don't do this if you're injured, but if you lift it like this, it gets stuck versus, right? So that's a little party trick if you want to impress the kids. So basically, that needs to happen. So you have the external rotation and you have the glide downward. So it does 2 big components. Then you have the teres minor, which also does the same thing, and the subscap helps with the downward glide. So that's why the rotator cuff is so important. If you want to remember the rotator cuff, it's SITS. That's the acronym, SITS, SITS. So now, what do we target? In physical therapy, when you come in with a shoulder injury, and if it's related to the rotator cuff, we don't go directly at the rotator cuff. Rarely, we don't go right at them, because that's the what? They're painful, right? They're screaming at you. So you wouldn't go in and start strengthening them right away, because they're just going to scream and scream, right? So what we do is you target muscles around the rotator cuff, which are the stabilizers of the shoulder blade. So we look at what attaches to the shoulder blade. So one of them is, again, the upper trap, the trapezius, which is this part here, the middle trap, which is kind of in the middle, and then the lower trap is coming from the bottom. So these 3 segments. And then the serratus, which is these tiny bumps here, it's coming in, attaching to the shoulder blade and letting it kind of stay flush with the ribs. Because the ribs are, a circular dome shape, and you want the shoulder blade to move along the dome. You don't want it to pop up, you don't want it to move around all weird, right? So the serratus is really important. And then you have the levator, which is kind of underneath the traps, coming up to your neck, and the rhomboids, which are here again, all stabilizing the shoulder blade. So the shoulder blade's like the dock, right? If you have a dock and it's wavy, right? So you have the dock on the wave that's kind of bouncing up and down, and you're standing on the dock. So if the dock is wobbly and it's like broken and the floors are all messed up, then you're going to probably fall in the water. But if the dock is stable, it's probably anchored down, then you won't fall, you can stay up. So, and I like this little thing. Shoulder pads, you mean traps. So everyone in the gym builds up their upper traps. They target these with shoulder shrugs. They work a lot in the upper body, and that gets really big. But then we're sitting all the time, so they already get big. They're already active, so you don't need to strengthen them more. What you need to do is to help out the middle trap and the low trap, so it's not an inequality in the muscle balance. So that's a little take-home message there. So, common shoulder injuries. 4 categories are Number one are tendon inflammation or muscle injuries. That's kind of the big one. So you hear strains, right? Muscle pulls, tendonitis, which is like the anchor point of the muscle to the bone that gets inflamed or thickened. Bursitis, which is like a little sac that gives lubrication and decreases friction between the muscle and the bone. Tears and impingement. That's the big one that a lot of people come in with. Impingement is one of the most common ones. Then you have instability issues, which can happen sometimes like dislocations or subluxations. We talked about how the shoulder is inherently unstable. So, if you go and fall on an outstretched arm, you can dislocate your shoulder. More of a traumatic injury, but people that are flexible, gymnasts sometimes, they can experience that, right? Because they have so much mobility. So there with those patients, we want to impart stability. So we do a lot of strengthening for that. Arthritis, commonly OA, osteoarthritis in the shoulders, and that's with time. So when you use your shoulders a lot, if you're a mechanic, you fix, you use your hands a lot, your arms, you're going to get arthritis possibly later in life just because you're using that joint so much, and that's normal wear and tear, but we try to slow down the course of arthritis. That's our goal. So arthritis, although it's a normal process that happens in life, we can always slow it down. And then fractures are, again, traumatic injuries. So fractures of the humerus, shoulder blade, that can happen. Car accidents, motor vehicle accidents, stuff like that. Again, some more funny cartoons. You don't have shoulder tendonitis if you've just been on there for too long. Basically, I like it because if you think about it, a lot of people have a drooping shoulder sometimes, or one shoulder is higher than the other. It's kind of the same concept, You have weight, which is gravity, pulling you down. And you can, again, that space that we talked about, the really important space, gets smaller and smaller and smaller and smaller. And then you develop tendonitis because it's getting rubbed up on so much. So that cartoon's pretty accurate. And then a frozen shoulder, little igloo on his shoulder. Frozen shoulders are very interesting. We don't know the mechanisms just yet. They're very obscure. A lot of times after surgeries, like dental surgeries or anything like that, you wake up and your shoulder's stiff and it kind of gets stiffer and stiffer over time, and then you can't raise it up. And that's a big range of motion issue. So what we do is we work on the joint, we go in there, loosen it up, and eventually you'll get the range of motion back. It just takes a little bit of time, a year or so. So that's one thing. Less common than impingement, but still there. So let's go into impingement, just to talk about that one because it's a big topic. We all have different bone structures. For the shoulder blade itself, that space here, we have 3 different types of kind of projections. One is a flatter one, so type 1. One is more like a neutral one, which is this one, as it's kind of curved a little bit, but it's not overly curved. And then we have one that's more hook shaped. So this is the most common one, and most people have this arrangement. But other people can have the more hook shape. So if you have a hook shaped arrangement, which you can see in x-rays, that's more susceptible to getting impinged because the space is smaller, right? So that's even more important to work on your posture and make sure that doesn't happen because you're already predisposed to it. And this kind of shows what happens when you get impinged. So this is like a cross section of the humerus and the scapula and where that muscle comes through. And here's the bursa, which is that sac to help it glide. So when this pushes up, you see that red area gets inflamed, irritated, there's swelling. You can possibly tear it over time. That's where the tears come in. If you keep waiting and prolonging the treatment, you can get a tear in that muscle. And the tear can be anywhere along that muscle. So really important. There's a lot of factors. Posture is number one. We always address posture. The muscle imbalances we talked about earlier where the front of the chest is tight and the back is weak. Strength function and repetitive movements. So if you're a cashier and you're always typing or you're boxing stuff and you're doing the same repetitive movements, that sets you up for more injuries of the shoulder. So it's always good to move around, change your position, be active, do different types of movements. So.
Can the wear and tear actually wear down the bursa, since that's really
basically what happens to the bursa is it gets inflamed and it gets irritated and it swells up, and then the space gets smaller and smaller as the bursa gets bigger and bigger. So you get pain from the bursa and then you get pain from the muscle. So then there's a double effect too. So yes, the bursa can get directly affected by that too. And there's bursa everywhere. There's bursa all over your body.
That's what I mean, and that's really a lubricant though.
Correct.
So
it's
is
a
it
lubricant.
really something that the body's producing, or it's there and it's going to eventually go away and never come back? Is there a way to
No, you can.
replenish?
Yeah, you can definitely get it to come back to its original position. I mean, you just have to take out the stressors, right? Because there's too much stress on it. You're not going to get that pumping effect. You're not going to get that dynamic fluid-filled sac that it is. But so some examples of exercises. There's so many you can do. I just put a little bit in there. Just so this one right here, when you're in that position, right, it's face down. Your goal here is, we talked about the middle and the low trap. When you're squeezing your shoulders, so imagine like I'm facing down on the ground, and if I pull my shoulders back like this, it's engaging the muscles that help pull the shoulder blades back, right? So I'm training myself to have good posture, and using the muscles that are not used in a daily basis. So that's one of the exercises there. Using the Swiss ball is super helpful, because what you can do is stabilize your trunk, right? So the Swiss ball gives you some stability here, and you can focus on isolating the shoulder blade. So you can start working on the shoulder blade. That's the hardest thing to do, is motor control, right? Your brain doesn't know what to do yet. So when you start doing this exercise, you'll feel like you're shrugging a lot. And this is very common, because that muscle is so active overall in daily life that it wants to help, right? Its goal is to help. And the other ones are just like, okay, well, fine, you do the work, we'll just hang out. So your goal is to, again, change your body mechanics and stimulate different muscles to be active. And stretching, right? Foam roller, everyone should have one. Doesn't matter what kind, squishy, hard, colorful, pattern. Just get one, lay on it, stretch the front of your chest, right? If we're working for 8 hours, we get home and we go back to bed, right? Straight to bed or watch TV. We're going back into the fetal position, we're closing again, you wake up, you're back in the car. So you really close off the whole day, right? So when can you open up? So take 5 minutes or so, lay on the foam roller, keep your hands out and stretch the front of your chest. And another version of this, these are called Ironmans. You know, how Iron Man flies around with his hands up like that. I don't know, I thought it was cool. And here's a cool video of, you guys tell me what you see. I'm just gonna play it. It's from a friend who had some issues with her neck. But I want you to look at her. So here, what she's doing, I'll stop it real quick. Okay, so this is a quick test. What you do is you kind of lean into the wall and you brace yourself. So you kind of fall and you brace yourself. So she's gonna show you what that looks like. So here's her left side. That's the left. Okay. And then she's going to do the right side as well. And that's the right side. So what are the differences you see? And what side do you think she has pain on? Left? What do you guys think, yeah? No wrong answers. I mean, I'll give you guys credit no matter what. It's not a test, I promise. So her pain is on the left neck area. The big thing to watch for is you can just look at the border here and the shade, right? The discoloration of that. So that'll give you a clue. As she falls down, right? Right now it's cool, right? So everything's good. Her shoulder blade is flat on the rib cage. When she braces her arm against the wall, what's gonna happen is it's gonna pop out. You see the shadow forming? That's her shoulder blade literally popping up off the rib cage, because the muscles that stabilize that area are not working properly. So if you think about it, it's all related again to the neck, right? Because if you have unstable shoulder, you're using it a lot, the muscles attached to the neck as well, they get pulled on, tugged on, you have neck pain, comes down to the arm. So here she braces herself, pops up all the way, and it's still popped up, and even as she comes up out of it, it's still kind of, so here it comes to the back and then pops up again right there, and it goes back. So that's what we're looking for. The other side doesn't do that at all. Her right side is definitely stronger, and there's no issues there. So she braces, you're gonna see she's already braced, and there's really nothing going on. So there's a huge difference. And we would measure that strength-wise, see what the difference is, and then target that muscle and the muscles around. So that's usually a serratus muscle injury or issue, the muscle that kind of envelops from the rib cage onto the scapula. So, and that's why she has one of the reasons why she has neck pain. now, let's do. Okay. Tools in the toolbox. What can you do at home right off the bat? What sort of things should you have? Because there's a lot of advertisements on important things to have. I would say a roller is for sure. Everyone should have a roller. You can use it for a lot of things, not just for your shoulders, for your legs too. A Theracane, which is basically a massager that you can massage yourself because it wraps around, it hooks on, so you can grab it and kind of work your muscles, especially up here, right, the upper trap. Dig in. Take it with you on trips. Massage balls, so you can put that on the front of the chest and work it out. You can put it on the back where it can be sore too. Carry that with you. And then new devices that are coming out now are postural trackers on the phone. There's back alert. There's upright go. So devices that you can attach to the back there, and it'll signal if your posture is looking good, looking bad, how far. It can give you the angle if you need it. And it goes to your phone and it zaps you a little bit. So it vibrates and then it gives you electric stimulation. No, there's no electric. It electrocutes you, jolts you. It just vibrates a little bit and wakes you up so you know that the posture needs to be fixed. We had our front desk, Sarah, she uses for about 3 weeks and her posture looked pretty good. I mean, she sits all the time, she types, and eventually throughout the day, she rounds up. So she was using it for a while, she liked it. It's tiring, you know, your back will be sore for a little bit, but kind of waking those muscles up. So, don't forget, you can't perform optimally with muscles that are too tight or too weak. So we have to address which ones are which, right? Which ones are tight, which ones are weak, and flip them around. So, you know, you guys stretch, 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 stretch. If all you can do, if you're not exercising, is stretch. So, I like this one because all the minions are working together. So that's kind of what your shoulder blade does. The muscles in the shoulder blade, they all work together with the rotator cuff. You have to work as a team. That's how you regain stability, mobility, decrease pain. You can't just have one muscle that just hangs out looking at everyone else while they're just doing all the work. It just doesn't work that way. And our goal with exercise is to make it functional. So the exercises have to accomplish a goal, whether it's pushing, pulling, lifting, pressing. All those are functional movements. You're not going to see one-sided, exercises. We don't do those. They're not functional. When do we ever need to do weird positions like this? Unless you're in that field or something. But all our exercises are very functional, right? Especially pulling. Pulling is the number one thing that we always do. Anything you can pull towards you, that helps to strengthen the back. And that's the PowerPoint.